Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. What causes bunions? A bunion is a large, bony bump that forms on the metatarsal bone. This prominence develops in response to hallux valgus, a condition in which the first toe gradually migrates toward the second toe. As the big toe becomes more and more deformed, the bunion grows more prominent in size. /r/n/r/n Ultimately, bunion pain can develop if the prominence becomes compressed by narrow shoes or begins to alter how you walk. /r/n/r/n This article will detail how bunions form, who is likely to get them, and how they are typically treated. /r/n/r/nwanderluster. Getty Imagesrnrn Bunions start off small in size and gradually become larger as time goes on. They form as a result of hallux valgus, which is actually a combination of these two big toe deformities. /r/n/r/n As these changes occur, a bunion begins to develop on the inner base of the affected big toe. /r/n/r/n While the most common type of bunion is described above, several other subtypes can occur. These include /r/n/r/n The reason for bunion deformity has multiple factors, both biomechanical and physiologic. Sometimes, more than one factor is occurring in a single person. These can include /r/n/r/n If you have a family history of bunions, wearing shoes with a wide toe box, a low heel, and good arch support could help you avoid developing this condition. /r/n/r/n Just because you have a bunion does not necessarily mean that you will have pain. In fact, many people with small bunions experience minimal, if any, symptoms. As the bump becomes more pronounced, however, certain types of activities may lead to bunion pain or inflammation. Among the most common causes of a flare-up are /r/n/r/n Barefoot walking does not commonly cause bunion flare-ups. In fact, going barefoot may actually strengthen the muscles in the foot and alleviate any compression-caused symptoms. /r/n/r/n If you are experiencing a bunion flare-up, there are several at-home treatments that may provide you with some relief. These include /r/n/r/n The evidence supporting many of these interventions is still somewhat questionable. In addition, it is important to note that while these treatments may reduce the pain you are experiencing, they will not shrink or stop your bunion from growing. /r/n/r/n The only way to reverse a bunion and restore the natural angle of the big toe is to have the deformity surgically corrected. More than 100 different surgical techniques can be used to address this condition. Factors like the degree of toe deformity and osteoarthritis in the toe often dictate which method is chosen. /r/n/r/n Following the procedure, you may be required to go through a period of non-weight-bearing, not putting weight on the foot, or wearing a hard-soled shoe for several weeks. Physical therapy is also typically ordered to help improve movement in the bigtoe and restore a normal walking pattern. /r/n/r/n/r/n Surgery is rarely performed for cosmetic reasons. Instead, it is usually only indicated if a bunion is causing pain or limiting your daily function. /r/n/r/n A bunion is a bony prominence that occurs on the metatarsal bone. This issue develops due to hallux valgus, a deformity in which the big toe pushes against the second toe. Women, older individuals, people with a family history of bunions, and those frequently wearing narrow-toed shoes are more predisposed to this issue. /r/n/r/n Conservative treatments like NSAIDs, toe spacers, and shoe inserts or padding may help alleviate bunion flare-ups. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.